balancing fall prevention efforts with maintaining of residents' independence and dignity can be a challenge. Obviously, there are some basic things like providing therapy for the strengthening of the resident to ensure that they're able to do things on their own is vital. But beyond that, we can use technologies like Helpany that allow us to preserve the privacy of the resident, but also be notified when the resident could potentially need help. And that allows our staff to be present when a resident is trying to ambulate in the room and potentially be there to deliver that assistance if it's needed or desired by the resident. Well, Helpany's been fantastic in complementing our existing strategies for fall prevention. It allows us to identify potential changes in condition in the health of a resident before our staff would potentially notice it, or even the resident would notice it. And then once that's been identified, we're able to put prevention methods in place that will help a resident to potentially avoid a fall. So Helpany has provided us with a number of instances where staff have been able to intervene and prevent a fall or deliver better care for our residents. We've implemented the PAL units with Helpany in our higher level assisted living, which has a large number of residents that have a cognitive impairment. And as such, oftentimes the safety awareness is compromised. Our staff have been able to intervene, and when a resident is potentially trying to move around unaided, when they do need help, we've been able to provide that assistance, whereas previously they may have gone about trying to ambulate in their apartment without the necessary aid and could have possibly experienced the fall. So as an example, we've had a number of residents who have had changes in condition and experienced less restful sleep, possibly due to increased bathroom visits, could be pain related, or just generally unable to sleep. And it's allowed us to see those patterns change and collaborate with the physician to make changes in medications to allow the resident to experience more restfulness in their sleep.